Maxillary nerve. The maxillary nerve, the second division of the trigeminal nerve, is purely sensory. Course and relations. It arises from the convex anterior border of the trigeminal ganglion. The nerve leaves the middle cranial fossa through the foramen rotundum to reach the pterygopalatine fossa. It traverses straight in the upper part of the fossa and enters the orbit through the inferior orbital fissure, hence it is called the infraorbital nerve. The infraorbital nerve, in fact a continuation of maxillary nerve, runs forwards along the floor of the orbit in the infraorbital groove and appears on the face through the infraorbital foramen. Therefore, in its course, the maxillary nerve traverses four regions in succession: the middle cranial fossa, the pterygopalatine fossa, the orbit, and the face. An important point to be noted here is that in the pterygopalatine fossa, the pterygopalatine ganglion is suspended from the maxillary nerve by two roots. Branches and distribution. Maxillary nerve gives off the following branches. In the middle cranial fossa, meningeal branch, which supplies the dura mater of the middle cranial fossa. In the pterygopalatine fossa, ganglionic or communicating branches, 2 in number, to pterygopalatine ganglion. Zygomatic nerve enters the orbit and divides on the lateral wall of the orbit into a zygomatico-temporal branch, which passes through a foramen in the zygomatic bone to supply the skin of the temple, and a zygomatico-facial branch, which passes through the foramen in the zygomatic bone to supply the skin of the face. Posterior superior alveolar nerve enters 1 or 2 foramina on the posterior surface of the body of maxilla and supplies the mucous membrane of the maxillary air sinus. Then it breaks up to form superior dental plexus, which supplies the molar teeth and adjoining part of the gum. In the orbit, or the infraorbital canal, middle superior alveolar nerve passes downwards and forwards along the lateral wall of the maxillary sinus, joins superior dental plexus, and supplies the premolar teeth. Anterior superior alveolar nerve runs in the anterior wall of the maxillary sinus through a bony canal called canalis sinosus and divides into dental and nasal branches. The dental branches join the superior dental plexus and supply the canine and incisor teeth. The nasal branches appear in the lateral wall of the inferior meatus and supply the mucous membrane of the lateral wall and floor of the nasal cavity. An important point to be noted here is that the superior dental plexus is formed by posterior, middle, and anterior superior alveolar nerves. On the face, palpebral branches turn upwards and supply the skin of the lower eyelid. Nasal branches supply the skin of the side of nose and the mobile part of the nasal septum. Superior labial branches supply the skin and mucous membrane of the upper lip.